psychologist with Aspen Point, and I want to talk about some of the mental health aspects of this change that we're all experiencing. So I know our community is flexing really quickly. Many people are moving to work from home at a really rapid pace, and there's a new normal coming, right? So what we've been used to was your rhythm, it was your routine, and now we need to lean into just developing new routines. So I'd encourage you to think through what would serve me best in this time? How can I best take care of myself, both physically and mentally? That could mean leaning into new ways of cooking, taking care of loved ones in the home, sleeping patterns, and also ways of lowering your stress. So I'd encourage you, even if you're home or if you're still in the workplace, lean into those areas where you can exercise. Find a way to physically release that stress. There's lots of options out there, including gentle methods such as yoga and stretching, moving all the way to YouTube videos where you could do a more aggressive workout. But I encourage you to not keep that stress and anxiety bottled up. It's really normal to feel anxiety in this season where we have a lot of uncertainty, and that's okay. But we want to make sure that it doesn't become overwhelming. So I would encourage you to give each other grace and extra margin with people you interact with. Know that with best intent, our whole community is shifting, and we want to do that to take care of one another. But it would be really normal for you to have a place in your day where suddenly you're feeling like anxious or maybe frustrated with something, and we want to take a deep breath and step back and say, okay, what do I need in this moment? What is my body or my mind telling me? And how can I respond to that in the best way possible? I'd also encourage you to practice gratitude. At the end of your day, before you go to sleep, what am I grateful for today? What good things happened? What would I like to see happen tomorrow? When we set our minds with intention, we can make a strong path forward, both for ourselves and for our community. So I'd encourage you to lean into that. And if the anxiety does begin to feel overwhelming, feel free to reach out. I know the Aspen Point Crisis Center and our telephone lines are open. We're ready to serve you. We also have many other behavioral health members in our community ready to do the same. So know that you're not alone and that there are people here to walk through this with you. It's uncertain for all of us. And that's a normal human response. So we want to meet you there and also journey with you. I'll turn it over to Chief Colas.